Welcome to the Maxicare Wellness Fridays, where we ask you the question that is still looming, perhaps in our minds. And the question is COVID-19 forever? My name is Patricia Bermudez-Hizan, and I'll be hosting for you today. And I'm so happy to be with you again for this webinar series. We are tackling a really relevant and important topic today. So please do share your thoughts and learnings of this event through your social media accounts using the hashtags Live Your Best Life and Maxicare Wellness Fridays. And please don't forget to tag Maxicare using their social media handles. On Facebook, it's at Maxicare Healthcare Corp. Their official IG is at Maxicare Healthcare, and the Health and Wellness IG at Maxicare Health and Wellness. Have you guys subscribed to their YouTube channel? Well, you guys can do that right now. Maxicare Healthcare Corporation is the channel to go to when you get the chance. For those of you watching our live stream, hello and welcome. Do press that share button right now and help educate your friends, your loved ones, your coworkers by posting this event on your pages. And please don't forget to hit that like button every time you hear something relevant to you. And I'm sure there's going to be a lot of likes for this particular event. Today, we'll be learning from our speakers, Dr. Sibel Abad with Dr. Jericho Alvaran, as they get involved in an insightful discourse about COVID-19. Our medical experts clue us in on what the near future is going to be like. Can they answer this question? Is COVID-19 here to stay, or can we ever be free of it? I know we're also excited to start this conversation, but can we please answer some poll questions first before we get going? This is going to be quick. You guys know the drill. All you have to do is to click the answer that best suits you. Are you ready? Here we go. Here is our first poll question. Do you think that we will have to live with COVID-19 forever? Do you think that we will have to? Then press yes. Then you think that there's an end to it and perhaps it's already at that stage, then please press no. We'd love to know what you guys think. And I'm watching out for those of us who are joining us, not on our live stream, but on our Zoom, what you guys think. And can we see the results, please, of our poll? Wow, I thought it would be a lot more. 53% believe that yes, we will have to live with COVID-19 forever, but some say, no, we don't have to. 47%, that's quite close. I am glad that you guys are with us today because our experts will give a lot of clarity. Here's our second poll question. On a scale of 1 to 5, 5, of course, being the highest, how well are you informed about the recent COVID-19 updates? Are you like me? I keep watching out. Like, I see it on my social media. I deliberately look for information. My children also got into a habit of getting updates. So are you like me, or are you more lax? Let's see what our attendees are saying. 44% are in the middle, and that's okay. But I am checking here that on the 4 and the scale of 1 to 5, there's a really big group also that still check it quite frequently. Well, I'm glad, but I think this next poll question will get us to know you a little bit more and how you feel about all this. After 2 years have passed, how do you feel about COVID-19? And I have some options for you. Do you feel that you're still very anxious about getting infected by COVID-19? You still live with that anxiety? What about number 2? I'm not as scared as before, like during the beginning of the infection, but I'm still cautious. Okay, if that's you, click on that. If this is you, click on this one. I feel like it's now just a common cold. Everyone gets it. Where are you? We'd love to know. Of course, this is a way for us to get to know our audience, right? Where you guys are at. And it's like really having a conversation. And looking at the poll results here, 63% say I'm not as scared as before, but I'm still cautious. We'll see. All right. Thanks so much for your insights, everyone. I love that you all are still very, very participative. That gave us insights, like I said, on what you think about our topic today, but I would love to get the ball rolling. It's time to meet your speakers. Our first speaker is a research collaborator for the Mayo Clinic, Clinic Associate Professor at the UPPGH, Infectious Disease Consultant at the Medical City, and the Chair of Infection Control Committee at the Medical City. She also has a board certification at the American Board of Internal Medicine, Infectious Disease. She is Dr. Sibel Lara Abad. Our second speaker is a pediatrician from the Institute of Pediatrics from the Medical City and also performs home healthcare assessments for HMO in the United States as he is certified by the American Board of Pediatrics. He took up his residency at the Albert Einstein Medical Center in Philadelphia and also practiced at the Children's Hospital in Wisconsin. Please welcome Dr. Jericho Alvaran. And please welcome both of our doctors here. Nice to have both of you. Hi, Dr. Bell. It's good to see you, Dr. Bell. Have you been busy? Because the last time we had our webinars, just like all doctors, frontliners, it was quite overwhelming. How are you doing now?
Hi, Ms. Pat. Thank you so much for welcoming us today. It's nice to be here this afternoon on a Friday afternoon. It's good to be asked that question today because the numbers are sort of going down and we have a breather. So it's been nice to relax a little bit the past few days.
Nice. Thank you. I love to hear that. It's really an indicator of how we're doing. It's really the capacity also and your ability to do this with us today. So we're so grateful. What about you, Dr. Jack? Being a pediatrician, are you also on that little bit more relaxed mode?
Yes, definitely. I'm a little busier seeing more patients face to face, but not because of COVID. No? The parents are more confident bringing their kids to the clinic. So I'm seeing more patients as opposed to doing teleconsults. So that's good.
Yeah, I love that. I myself have a toddler, a 2-year-old, and we're due to see our pediatrician face to face. It's going to be so exciting. But Dr. Sibel, Dr. Jack, before we begin this conversation, let's first have our trivia time. So this is a point where we share with you some trivias, and we're going to be taking it up sometime during this conversation that we're going to be having with our experts. But these trivias are here to also help you for today. Here's our first one. There are hundreds of coronaviruses, and some of them cause diseases in humans, such as mild colds and more serious illnesses or death. The SARS-CoV-2 coronavirus, along with those that cause SARS and MERS, are examples of coronaviruses that can cause serious illness in people. And this, according to Hopkins Medicine. Good to know. Here is our second trivia. An effective hand sanitizer contains at least 60% of alcohol to kill the coronavirus and other germs. And that's according to Hopkins Medicine. I wonder, are you still in the habit of checking the labels of your sanitizers and alcohol and everything else? I hope so. And we're still checking if it's at least 60%. Here's the third trivia. COVID-19 is the first pandemic since the 2009 swine flu or H1N1 pandemic. But unlike COVID-19, H1N1 mostly affected children and young adults, according to World Vision Org. Well, these information and this next one will definitely help us. Here's the next trivia. The COVID-19 pandemic pushed an additional 97 million people into extreme poverty in 2020, according to the World Bank estimates, and this from the World Vision Org. And I say that this information helps us because it really just brings the reality that all of us are affected. All of us have been affected in every and any way because of this pandemic, financially, our emotional health, our mental health, and of course our physical health, and even our children's interaction and social interactions at that. Honestly, I'm just so glad that we're all here together despite what's really happening out there. And I'm glad that you made it today. Now, here's the final trivia. As of March 24, there are over 474 million COVID-19 cases, and there had been 6.1 million deaths. And this is from the New York Times tracking. And gosh, if I could just bring Doc Sibel and Dr. Jack back in this conversation, because that stat really is staggering. We normally just take a look at what's happening here in the Philippines, maybe sometimes in our communities, but in this country, we know the numbers. But then if you take a step back and you take a look at that big picture, it's just 6.1 million deaths. But I ask you, Doc Sibel, and I start with you. How are we now doing with COVID?
Thanks, Miss Pat. So that's another good question to answer today, specifically March 25, because the answer is a good answer. So we're doing very well in terms of COVID 19. As you can see flashed on your screens, hopefully, are our numbers that are already being um, published on a weekly basis, because the numbers are low enough that they can be accumulated rather than shown on a daily basis. So our daily numbers are actually down from a height of 39,000 in a single day last January to just around 500 per day. But I guess a word of caution, the 500 per day is not zero per day where we want to be. It means it's still there. We still haven't flatlined the virus. It's still kind of in the background, so that we don't want to forget that. But good news for today is that the numbers are on their way down. And in this second slide, as you can see, the opposite in terms of vaccination, our vaccination numbers are indeed going up. So our coverage in terms of the total population being vaccinated is overall around 60%, but depending on the target population, as you can see there on your slides or on your screens rather, it's closer to 70 to 75%. So long way from a year ago, now where we didn't have any vaccines. So we've come a long way and we're going in the right direction.
Yeah, and even at the peak of January, it feels like eons ago. Maybe for some, right? Because it was just so hectic. I was one of those that got infected in January. But for you, Doc Jack, how do you think we're doing now?
Well, first of all, for me, my experience compared to that of my better half was a little different, no? So I wasn't really seeing any COVID in my patients for the first year of the pandemic, no? A good reason for this, of course, was the stricter measure in place, such as the higher alert levels and the hard lockdown. There was less risk for exposure for our pediatric patients, but with the surges that we experienced over the past year, we saw more kids being admitted to the hospital for COVID 19 infection. Most recent was the surge in December 2021. Fortunately, over the past few weeks, we are seeing a much improved census in our practice and in the hospital.
I'm glad because that's exactly what I wanted to ask you for my second question. If we still have a rising number of COVID with children in particular. So that's good, Doc Jet.
I don't have hard data on the exact numbers, but over the past few weeks, admissions and consults due to COVID in kids have gradually declined. A rough estimate would probably be out of all the positive cases that we have, 15 to 20% would probably be in the pediatric age group or bracket. However, this could be an underestimation because most of the cases in the pediatric population are asymptomatic or
Mm-hmm.
very mild, and thus these patients do not consult or get tested anymore.
Oh, thank you so much. And, I know that we may have a lot of parents here. And it's good to know. It's good to have you actually also on this panel. But I'd like to go back to Doc Sibel. Are there really new variants of concern? We've been hearing all of these transformer type names, right? But do
That's
tell us.
right. So, technically, there are no new variants of concern. We're still stuck with the Omicron being the last one. But as Miss Pat mentioned, the variants are now combining into a transformer type. So, from Omicron and Delta, we now have Deltacron, where they found these two variants in a single person. So, medyo malas itong tao na to. He had these two strains, and so it's being called Deltacron. And that's what we want to be wary of, because for as long as there's transmission anywhere in the world, these strains can recombine and form a new transformer, which we will name, Megatron eventually or something like that. No, so that's something we have to watch out for. But at the moment, there is no new variant of concern. There is a combination of Delta and Omicron variants, which they are now calling Deltacron. So we have to keep an eye on that, whether it will become eventually a variant of concern.
So, with that, I asked Doc Sibel again, are booster doses really necessary and even a second booster dose recommended?
So it's nice to talk about this topic because we didn't really have vaccines or boosters, a year ago or something like that. So now we're talking about, oh, can I have my fourth or my fifth booster? So to answer the first part of the question, so boosters are necessary, because they've been proven to increase the effectiveness of your primary series or your first two vaccines, so to speak. So to get a better kind of response from these vaccines, because they do start to wane over time, you will need that booster dose. Now, for the second part of the question, do I need another one? So we're talking about the fourth dose now.
Huh?
So that is a little bit more controversial because the numbers of vaccines are finite. No, it's not like it's a never-ending supply. The supply is always an issue. And also, the science does not back up the fourth dose for everybody. What it does back up is that the fourth dose is probably necessary for those who are high risk of getting bad COVID-19. So that's the senior citizens, those are our colleagues with comorbid illnesses, or our colleagues with immune compromising conditions, such as having been transplanted, like a kidney transplant recipient, or maybe having HIV. So those are the ones who we should prioritize for that fourth dose. But if you're young and healthy like Miss Pat, then perhaps you don't need that fourth dose.
Really? Am I? Am I? Maybe healthy, but not young. But I'd like to shift to that. I want to talk to Doc Jack about that. What about boosters in children? There's really a big question, around
Right.
getting boosters anyway, but particularly for children.
Here in the country, currently, we have not recommended booster vaccines yet, primarily in part because we just started vaccinating the kids, no? And they're still finishing the primary series. Booster doses are necessary in general because, as Dr. Abad said, vaccine-induced immunity wanes over after a few months. In the US, actually, kids more than 12 years of age are already recommended to get a booster
Yeah.
dose at least 5 months after the primary series. So, very likely down the road, we will eventually ask these kids to get a booster dose or even annual vaccination.
All right. Well, Doc Jack, and Doc Sibel, maybe I'd like to shift now to this conversation because we're now in alert level 1. Yay! But we're not. Talaga bang mag-shift tayo sa zero? Zero means nothing anymore, right? I don't know. But we are now in alert level 1. What are the things that we need to know about, being in this alert level? And can we be more relaxed, really, in terms of our health and safety protocols? Because that's really the trigger, right? Kasi wala namang zero. Ito na yung pinakamababa, alert level 1. So I think that's probably why a lot of people are relaxed. But like I said, Doc Sibel, we'll start with you. What are the things that we need to know about this and protocols still?
So if you look at the kind of the fine detail or the fine print of the alert level 1, you will actually realize that the only difference between 1 and 0, so to speak, is your mask. The mask is the only thing. It's kind of the last layer between normalcy and the new normal. So I think in a way we are starting to relax because the numbers are indicating, or the science is indicating, that the numbers are going down. So we can't be forever stuck inside our own bubbles and forever not going out. So we're starting to peel off some of the layers. No? But remember that alert level 1 is, as Ms. Pat mentioned, not zero. It does not mean that COVID is gone. It's still there, kind of in the background somewhere. And so we still need those masks in place.
Doc Sibel, thank you for that reminder because there are people like myself na sometimes parang you forget, oh nga no, meron pang COVID. So unfortunately, yes, that's probably why I got it last January. I still can't figure it out. But I'd like to ask that same question to Doc Jack about, can we be more relaxed in terms of the health and safety of our children? And what about the
Right.
protocols that we should still have in place?
Yeah. So again, as a review, no, for alert level 1, no more restrictions for movement of individuals. No restaurants, public transportation. They're all operating at full capacity already. No? The only requirement we have is to wear masks. Face shields are not required anymore. But it is worthwhile to note that other countries, such as Hong Kong, China, countries in Europe, are experiencing surges, most likely because they relaxed the masking mandates too soon. So we should still stick to what has worked for us before: hand hygiene, spacing if possible, and of course, wearing those masks with continued vaccination.
Wow, thanks so much for the reminder and bringing us back to really what reality is. And sometimes we need that. That's why I'm glad that we're having this conversation, because maybe there's not enough of this kind of conversation happening out there, and people begin to be misinformed and making poor choices perhaps. I don't know. But now that most of the companies are preparing their employees to report on site, those who are watching us, whether on live stream or here on our Zoom room. Are you guys back in the office? You can share with me on the chat if you guys are already working in the office. But a lot of people are reporting on site. Sometimes I think almost full capacity na ba, or some are staggered. But how can we prevent COVID in the workplace, Doc Sibel? Those barriers, should they still be there?
Yeah, so 2 years later, no, the layers of prevention really have not changed, no, with the addition of the vaccine, perhaps, but the layers have not changed. So they're still around and they're still very helpful. Siguro the ones that have changed is just a shift towards which layers kaya are most important to keep in the workplace. So, for example, uh, because we have time, no, as Miss Pat mentioned, there is staggering still in some workplaces. When you have time, you have to assess your workplace. Is it well ventilated? Because if it's not well ventilated, then you have time to prepare, maybe put in some filters, or open some windows, open up some doors and some spaces, things like that. Because that's one layer of prevention that you will have to work on in an enclosed workspace, no, unless you work in somewhere like Boracay, where you have all the space in the world. So if you're lucky enough to work in an outdoor space, then ventilation will not be such a problem. Other things you have to keep in mind also in the workplace is that one of the things that we tend to do in the workplace is, of course, eating together, which, of course, is kind of a no-no with COVID just kind of there still. And so it's very hard, I know, because who wants to eat alone in a workplace? It's actually our downtime, right? But kind of just things to keep in mind, because when you are eating, that's when you're unmasked. And so when you're in a big group of a small space, so that's kind of a no-no, so to speak. No, but I think maybe you can just eat with maybe one or two close friends or something like
Right.
that, rather than a big group. So those are choices we all have to make, no, which is kind of very hard, no, because it's
Mhm.
hard to always eat alone by yourself in the workplace. um, those are the main things I think that you should work on in the workplace, is keeping ventilation in mind, and
Yeah.
also keeping in mind maybe having to still have some restrictions in place. And of course, if you're in a big open space, always keeping your mask on, no, if unless you're doing something else like eating, so something like that.
Hats off to all those companies that really have been making several adjustments to ensure that there are health and safety protocols. I understand that, of course, they have to spend and invest, but of course, the returns of having all their personnel back in the office is good. I see some people chiming in on the chat that they're still on a hybrid setup. Some are in full capacity, and the others are gearing to be on full capacity already in the next couple of months. So, it's great to know that. But also, I love that you reminded us about eating and socialization in general. We are also reminded in the office that we shouldn't eat in common places. You stay in your desk, and there's still some reminders. So hayaan mo nang sabihin nila na medyo antisocial ka or hindi ka namamansin. Okay lang, basta you're healthy. But of course, everyone will understand. But what about in school? Nako, ito na tayo. Doc Jack, many schools are preparing already, and my children are homeschooled, so they stay here anyway. But a lot of people are preparing for even a staggered setup. Parang batch A, batch B, pupunta dito sa araw na to, pupunta sa next. Tas lahat din sila may barriers, and I see photos and videos of schools implementing this, and that's great. But how can we still prevent COVID in schools? How
Right.
about our children?
So, I mean, this next school year, no, most of our schools will probably be back to face classes now. No? or maybe like a hybrid type of classroom where you will have both online and face-to-face interactions. It would be very hard to monitor our younger children in terms of enforcing our minimum health and safety protocols. No, it would entail a very good plan for the school itself. Um,
Mm.
Vaccination may probably be have to be mandated for kids who are going back to school. Unfortunately, no. Constant reminders by the teachers to do hand hygiene and practice social distancing would be very important. You would probably have to be a little creative during snack or lunchtime. Maybe have a designated outdoor area for the kids to eat at, or maybe have like a decking schedule if they have to
Mm.
eat indoors. As it has been proven, as like Dr. Abad said in the past, that most of infections occur when everyone is unmasked in an indoor area with poor ventilation.
Actually, I'm glad that you mentioned that because I was gonna ask, as a parent, asking for a friend and asking for other parents, ano ba dapat yung mga tanong kasi or ano ba dapat yung mga tinatanong natin sa schools? Because sometimes for the schools, we'll just take their word for granted. But as a parent, I want to ask the right questions, specific questions, right? That will ensure if my child will be safe in that area. But of course, ang question ko rin, Doc Jack, meron ba? I'm just curious, guys, okay? Meron bang limit to the number of hours a child should be wearing a mask? Ako parang hindi nga ako makatagal wearing a mask. But should there be a limit? I don't know. I've never actually seen or never figured it out.
There's no specific number. Of course, the older the child, it's going to be easier for them to wear a mask longer. No, um, our 10-year-old actually was able to wear a mask for how long was that? 14 hours, um, because we are on a long flight. No? So I guess he was okay with that. But again, it would be different as the age goes down. No? It would be harder for them to wear masks longer. So it it definitely will be very difficult.
Yeah, for my 2-year-old, parang 2 minutes lang, punit-punit na sa mask. So, obviously, we had to train her and play here at home, right? And practice and everything. So, when we saw that she was keeping it longer and longer, medyo nagkaroon na rin ako ng confidence na ilabas siya. At makakita naman siya ng buildings, di ba? Or in your part, Doc Sibel, di ba, makakita naman siya ng puno in real life. Hindi niya sinaswipe yung puno or something.
That's
But
right.
that's right. That's good. Here, okay, I'll ask both of you this question: is it safe to bring our children and elderly in public places? Maybe I'll start with Doc Sibel and tackle the elderly issue.
Yeah, siguro I will just focus on the elderly, no? So it really is, it kind of depends on the family, no? It is safety, I think, is a relative term for some, no? It also depends on your experience with COVID-19. I think you will have to think long and hard about bringing your seniors or your elderly lolo and lola outdoors to the mall, for example, because they are at the highest risk of getting very bad COVID-19. At the very minimum, they will have to get vaccinated before you let them go out, into the world, so to speak, out of their bubble into the mall. And you will also try to figure out if they're kind of a healthy, older adult, senior, no, minimal comorbidities, minimal medication list, and perhaps they can go out. But if they're kind of fragile, they have a lot of medications, they have very bad lung disease that's not COVID, then maybe you should think long and hard before you bring them out to a poorly ventilated space with lots of people. No, you can still bring them outdoors, maybe to
Yeah.
a park, maybe to the beach, no, somewhere with good ventilation, and not that's something that's not very crowded. So, for example, I have our parents are both octogenarians. They're 80-year-old, so they have not seen the mall, or I hope they haven't seen the mall. Because minsan tumatakas yata sila, they just don't tell me. But they are fully vaccinated and boosted. So, at the minimum, dapat ganon, no? Because they really tend to get very sick with COVID-19. So, we have to protect our seniors still.
Yeah, thanks for reminding us that we can now go to the beach. It's really a recommendation for us to bring our families to the beach. But honestly, yes, we have to take those precautions. And I love that list of checks that we need to do first before bringing the elderly. Thanks, Doc Sibel. What about you, Doc Jack? What about for our
Uh,
children? Is it safe to bring them out? Nakaganto
yes.
ako kasi
So this is a
connected.
question that parents always ask me. No, the first thing I usually say is if you don't need to go out, of course, it is still advisable to stay at home as much as possible. Now, I know that's impossible if you are going out to help balance your child's life, and mental health. My advice would be to go to an outdoor park instead of the mall. Now, if this is still not possible and you really have to go to the mall, maybe to show them the escalator or something like that, I hope your child is vaccinated. Have them wear a good fitting mask. Try to avoid the more crowded areas of the mall. So if you see like a big crowd of people on one side of the mall, I would suggest you turn around and go to the other side. I would still not recommend those who are not vaccinated to go out and mingle with other people unless you are going to maybe a secluded part of a park or a beach or something like that.
Thank you. Yun lang ang nasabi. Thank you. Okay, we're just gonna have to have another conversation with my family after this. And I'm sure all of you who are watching us, whether live stream and on Zoom, there's a lot of things that you're also thinking of because of this conversation, and that's the whole point of it. We're glad. Question na to, is it possible to still have another surge in cases? Doc Sibel, posible pa ba? At saka, ang isang tanong dyan, kaya pa ba natin? Hindi, yun lang. Posible pa ba?
Yeah, so unfortunately, my answer is not such a good answer, because the answer is yes, it's possible. And it might just be around the corner, actually. If you look at the what you call red flag signs, no, in Europe, closer to us, in Hong Kong, in China, where it all began, in South Korea, dumadami na naman yung cases nila, no? Now, having said that, it's also because, as mentioned earlier by Doc Jack, they also relaxed very fast. They're removing their mask mandates already. So wala na silang mask, parang zero na sila, level zero, kumbaga, no? And so, but because of travel, no, isang plane ride lang yan, and then we end up yet with another surge, no? And for as long as there's transmission anywhere in the world, we can always form new transformer variants, and here we go again, no? As mentioned nga, parang take 5 na sa US, sa atin take 3 na, para tayong recurring movie, no? Pang-apat na yung next, no, which would not be a good thing. And as Miss Pat mentioned, kaya pa ba natin? I'm not sure. Actually, nauubos na yung healthcare workers, napapagod na lahat ng tao. And for each surge, the consequences are more and more, no? Parang ganon siya. So unfortunately, the answer is it might just be around the corner, and surges are still possible.
Sorry, on that note, I wanted to ask also because I've had conversations with friends and sinasabi nila, nakita mo yung trend, pababa na yung pababa yung severity ng symptoms ng pandemic, sorry, ng COVID. Tama ba yung trend na yun? Is it good to put your hopes on that one, that it's just gonna be a common cold eventually?
So that's a little bit more difficult to answer, but Doc Jack and I were just listening to a podcast earlier where there was a virologist from Mayo Clinic just talking about kind of the danger of that COVID is mild and COVID is just like a common cold, because we're now just starting to realize that COVID has a lot of what you call consequences, and there might be long-term consequences that we will just figure out, several years from now. So an example would be long COVID, where people have symptoms despite having cleared COVID. They have brain fog, they have difficulty concentrating, they have problems with their heart, they have problems with their lung, their kidney, etc. And all of this despite having mild COVID. So I
Yeah.
would hate to label COVID as just as any other cold, because the consequences can be bad.
Thanks. My mom, she's in Canada and she has COVID again. And it's cough, just even though sabi nila ubo lang yan, pero ubo ng ubo, and it's been for a while. I'm gonna stay with Doc Sibel for this one because I'd like to know, with the rising number of fully vaccinated individuals, is this pandemic nearing its end?
So, well, it's a good thing that the number of individuals that are vaccinated is rising, no? But as mentioned earlier, we cannot be parang just focused on the Philippines. So in the Philippines, mga nasa 60% na tayo, 70% in some groups, even 80-90%, depending on where you are in the Philippines. But unfortunately, if there is COVID, let's say, somewhere else in the world and their vaccination rates are just 20%, then iikot na naman yan sa atin. So that's the problem. We have to look at the vaccination in a global setting, and as a parang as a world wide phenomenon, we are not doing such a good thing in terms of global vaccination. No? Some parts of the world that are poorer than ours are still in the 20-30%. Can you imagine? And some actually have not even started their vaccination process. So until we get our act together, then this will not end, unfortunately. So kind of sad news there.
Yeah, yeah, and Doc Jack, your dog agrees.
Yes. Sorry.
No, no, it's fine. This is how it is. But here, Doc Jack, I have a question for you, and this is the question: is COVID forever? Can this virus be eradicated, or shall we learn how to live with it?
Unfortunately, I do not know the answer to this question, no, but I can give my own opinion or theory. With how this virus has behaved during the past 2 years, no, meaning, as Dr. Abad said, we've seen this movie a few times already. We've seen different variants coming out and causing multiple surges. We will most likely have to deal with this virus as an endemic, just like the influenza virus. We will probably need either booster doses of the vaccine or annual vaccines, just like the flu shot. Good news is we have new vaccines being studied, will hopefully be even more effective in preventing infection or complications from the disease. I personally would probably always wear a mask in my clinic. Fortunately, I actually haven't had any cold for the past 2 years, which is awesome. Probably because I was wearing
Wow.
a mask all the time. Before COVID, I get a cough or a cold from my patients almost every month. So
Wow.
until we achieve herd immunity, either by natural infection or vaccination, we probably won't be able to get rid of this virus.
And from
And
your perspective, yes, and that was another bark in agreement.
Agreement. Our dog is a
Yes,
smart dog.
absolutely. Let's have him on
Yeah.
too. But no, Dr. Bell, I also want to ask you this question, the same one. Is it forever?
So I yes have a very similar take on it as Dr. Jack. No, the pandemic will probably not be forever, so that's a good thing. But it will
Mhm.
probably become endemic. So endemic just means it will kind of turn into something like the flu, something we might have to learn to live with. No, but
Mhm.
hopefully the numbers will be much better by the time it becomes endemic, because we cannot live with, let's say, 500 cases per day or 500 deaths per day in some parts of the world. We want to bring it down to a very acceptable level before we say, okay, it's here to stay. But the pandemic will not be forever. It might just be become endemic in the future.
And yes, we're looking forward to all that, but looking forward also to other portions of this great conversation that we've been having here for our Maxicare Wellness Fridays. This has been great. Thank you so much, Dr. Sibel and Dr. Jack. We're not done yet. Many of this information that you shared with us are really, really appreciated by all of us, and I see some great feedback here on our chat. But in just a short while, ladies and gentlemen, we will have our live Q&A discussion. So make sure to send in your questions right now using the Q&A button. We'd love to know what you guys would like to ask our experts. But right now, let us first move on to a really new and exciting segment called Myths or Facts. With the help of our experts today, we will determine if the statements that I'll be sharing with you is a fact or a myth. The best part, you guys get to be involved in this segment. You know, our statements will appear using the poll feature of this Zoom room. So all of you will have to do just to be involved is to click on fact if you think the information is correct, or myth if you think it's false or it's an idea that hasn't been proven yet. Clear? Are you ready? Here we go. Here is our first statement. I already had COVID-19 and recovered. So I don't need to be vaccinated for COVID-19. Guys, is this a fact or a myth? What do you all think? Let us know. We should have like do 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 do. But honestly, I'm sure that there's a lot of debate, and we have 93% of you there. There you go. Good job, guys. 93% of you saying that it's a myth. Doxibel, are they correct?
So that is correct. It is a myth. So there are studies now that are showing that the best combination is actually having natural immunity plus vaccination. That's the best protection we can have. See, our dog agrees again. And and so the other portion of it is if you get COVID-19, it does not give you long-term immunity. Similar to other viral diseases such as measles. Measles you can only get once because there's only one type of measles. Unfortunately for COVID-19, as we've already seen, it can transform to other variants, and so that's why the immunity is not lifelong. Ergo, you will need a vaccination even if you've had COVID-19 because the vaccine will protect you further from other types perhaps or subvariants of COVID-19.
Thanks. Very clear, Doxibel. I appreciate that. And people, I'm sure you all are taking notes. But here is our second statement. Tell us if this is a fact or a myth. Getting the COVID-19 vaccine means I can stop wearing my mask and taking coronavirus precautions. Forget about it, right? Fact or myth? Come on, guys. We all know what your answers will be, but I'd still like to see what you guys think. I mean, a lot of people feel that they already got COVID-19 and a vaccine rather. So they're like superheroes. See, we still have 3% in our crowd that still think that this is a fact. And of course, the rest of it, the 97%, say it's a myth. Doc Jack, why don't you end this debate and tell us?
Okay, so this is a myth. Getting the COVID vaccine does not give you 100% protection from getting the infection. So you will still get what we call, or you can still get what we call like a breakthrough infection. The main goal of vaccination is actually prevention of hospitalization and severe disease, as well as decreasing the incidence of complications. So even though you got the vaccine and you're almost certain that you won't get severe disease, you can still get infected. So wear those masks, practice good hand hygiene, and distance yourself as much as possible.
And those are constant reminders. We hear it all the time. And why does it need to be said over and over again? Because sometimes we forget, or we think, wala na, hindi na ako matatamaan. All right, so here is the third statement. The vaccines can give you COVID-19. Oh, I'm confused. Is this a fact or a myth? Come on, guys. Can you guys let us know what you think? There are you can tell us if you agree with it or if you think this is unproven. And I'm already looking at the poll results. Wala pa eh. But I want to see already if this is something. All right. So we do have, of course, majority think this is a myth, but there's still a good percentage. There's still 7% of the people here thinking that that's a fact. Doxibel, this being right up your alley. Do the vaccines or can the vaccines give you COVID-19?
So this is, of course, a myth. The vaccines do contain a portion of COVID-19. So siguro kung piloso po ka, yung answer mo, it's correct because it does contain COVID-19. But it will not give you active COVID-19 disease because it contains only a portion of the virus, and that portion has been inactivated and cannot suddenly turn alive in your body. So it's called an inactivated vaccine as opposed to a live attenuated vaccine. Although some of the vaccine manufacturers are trying to concoct a live attenuated version of COVID-19 for healthy people who might be able to tolerate it. No? But at the moment, the current vaccines will not give you COVID-19 and cannot give you active COVID-19 disease.
Yun yung sinasabi nila na may mRNA, no? Na that gives you. So there, hence the confusion. So it's good that we're educating people, and I like how people on our chat are also getting to share with us what they think. Great job, guys. We love that you give us feedback and want to clarify these things. But I have this next statement to clarify whether it's a fact or a myth. I'm reserving this for you, Doc Jack, but let's ask the people. Here is the next one. It's not safe for children to be vaccinated for COVID-19. No, 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 no. Is this a fact or a myth? Are you guys parents? You guys will probably, have a bit more investment when you answer this. You're invested when you answer this. But I mean, whether you have a child or not, please do answer. And again, overwhelming, of course, feel that this is a myth. Doc Jack.
I agree. So this is a myth as well. No, the vaccine that has been approved for our kids 5 years and above has been studied and proven to be very safe. No? So the benefits that you get from getting the vaccine will far outweigh the risks for any side effects. No. Now, some may say that we really do not need to vaccinate our children since most of the cases are very mild. This statement may be true, but there are still serious complications seen in cases of COVID in children. No? So one of these complications you might have heard of, it's called MISC. It's a multi-system inflammatory condition in children. No? So different body parts can become inflamed or swollen, including the heart, lungs, kidneys, your brain. So if I would have a way to prevent this from happening, I will definitely take it. No? So again, there were no shortcuts involved in the study of the efficacy and safety of this vaccine. So we should all be confident in having our children vaccinated. So my kid was vaccinated as well.
A question, Doc. Like I mentioned, I have a 2-year-old. Will there be a vaccine that will be approved here in the Philippines that will be safe for toddlers or even infants, smaller children?
There are studies going on. Pfizer actually studied for this age group. However, the results were not that good as compared to the ones that we are using for our 5-year-old kids and above. No, so the reason for this was probably the dose that they used was a little lower. So they are doing more studies for this. So eventually, we'll probably have this population vaccinated as well, most likely.
Thank you. And now for our final statement. Are you ready? COVID-19 vaccines have severe side effects, especially for children. Fact or myth? May ganun pa talaga. Fact or myth? Yeah, you hear a lot of chatter. There's a lot of conversation about this. But before we get into that, let's see what our poll results show. Wow. Okay. So a lot more people now are saying that, yes, this is a fact, but still overwhelming, majority still say that this is a myth. So more and more people now believe that there are side effects, especially for children. But first, let me break it down. Doc Sibel, are the COVID-19 vaccines have severe side effects?
So they do have severe side effects, but just for a minority of adults. And we're talking about adults here. So when you get vaccinated, it's always a personal choice, and always you're trying to weigh the risk versus the benefit of the vaccine. So will the vaccine be beneficial? Will it protect me against disease? Or is the risk very high that perhaps I should not get vaccinated? And now, 2 years later, we have proven again and again that the vaccine is very effective and very safe in terms of trying to prevent COVID-19 and trying to prevent the complications from COVID-19, which really come when you are unvaccinated. So when you're trying to weigh the risk and the benefit, the risk being serious side effects such as a blood clot in adults, for example, or maybe a minority can get myocarditis. And Doc Jack will talk about that more in children. The numbers really do not show this. The numbers are very, very low and just a minority in adults. And for the most part, the side effects are very common and mild. So you just get, a pain in your arm, maybe a fever for 1-2 days. So I think at the moment for adults, especially, the risk is very, very low, and the benefit or the gain you get from vaccine is very, very high in terms of trying to prevent death and serious side effects from COVID-19.
Thank you. I'm glad that we have the perspective coming from Doc Sibel. And now we'll get the perspective coming from Doc Jack being a pediatrician. So what about those severe side effects for children?
Right. So I will preface my statement by saying that all vaccines actually have side effects. No, the side effect profile for kids is generally the same as those in adults. You would expect, pain on the injection site, maybe redness, development of fever for a couple of days. Some may experience muscle fatigue, headaches, or nausea. The serious side effect that most parents probably have heard of or read about is myocarditis, or inflammation of the heart muscle. This side effect is very rare. It was noted in teenage males more than 15 years of age, but it should be noted that this was self limiting, meaning it resolved on its own and was very mild. You should also know that COVID infection in itself can cause myocarditis, and the incidence is much higher with the illness itself.
Thank you. Thank you. I love this conversation, and I love that everyone is involved. They get to chime in whether they think it's a fact or a myth. And we have our experts giving us insights and clarifying. Thank you, everyone, for participating in that fun fact or myth segment. And also, of course, to our experts for giving us a lot of clarity on these facts and myths. Now it's time to tackle questions that our attendees have sent on the Q&A box. And I love also that these questions are quite specific and very different from what we've already tackled earlier. Here's the first one. What are your thoughts for vaccination not mandatory? And would you recommend for everyone to get vaccinated and have it as mandatory instead? Dr. Bell, I see you smiling. I'll go to you.
I think you're going to get me in trouble. So, in the ideal world, it would be mandated because this is a public health crisis. So, the situation is different because it's a global crisis of unheard of proportion, so to speak. No, but because we live in this world where personal choice is also very big. No, you have to make that personal choice by yourself. Then we cannot mandate vaccination because at the end of the day, you will have to choose for yourself. But I guess you just have to keep in mind that your choice will affect others, no, not just yourself, your family members, your relatives, your friends, etc. So when you make that choice not to get vaccinated, then you have to live with the consequences, so to speak, that you're affecting not just yourself, but others in your same bubble. No, so just think of it that way. But unfortunately, I don't think we can mandate vaccination.
What about Doc Jericho? Would you be able to give an insight on that from the children's perspective, at least for the 5-year-olds and above?
Right. Again, if it were up to me, I would require vaccination, especially if you want your kids to go back to school. No? Again, as Dr. Abad said, unfortunately, we really can't do this. We have to respect everyone else's rights to refuse. But in an ideal world, everyone should definitely be vaccinated. This is for the purposes of herd immunity as well, because if we want this pandemic to end, herd immunity is a requirement.
Thanks, Doc Jack and Doc Sibel. We have a couple of more questions. I like this one also. Will a pan-coronavirus vaccine extinguish the COVID-19 virus? When will it come out for global distribution? How long will it take the Philippines to get the latest improved vaccines against COVID-19? Such a packed question. But I think Dr. Sibel has the inside info.
No, I was gonna make the joke and say it's tomorrow. It'll be available tomorrow. No, no. People are working on it. It's a race, actually. Different institutions are working on or have money to work on the coronavirus vaccine, no? But as to when it will come out, that's the biggest question. And whether it will work will be another question, because this virus has really become very tricky for us to try and eradicate. Because every time we think we're there, it kind of changes and evolves to become another variant or a subvariant. And so it's a little bit tricky. It's kind of
Mhm.
very difficult, I think, for the vaccinologists and the basic scientists who are working very hard to produce that pan coronavirus vaccine. I think it's possible, though. I think it's not impossible, but the timing of it, I'm not sure. And being a third world country, unfortunately, we will just have to wait our turn.
Yeah.
We unfortunately have to wait until someone else comes out with it, and then it will trickle down to us. So it might take some time.
All right. I want to ask Doc Jack this question, and I love that this has been asked because I also wanted to ask this question. Is it still not advisable to travel abroad via plane? Siyempre, di ba, may kanya-kanya di ba? May mga talagang nararamdaman
Right.
tayo na hindi tayo safe. But ikaw, Doc Jack, do you think it's advisable to travel in a plane? Abroad na
Um,
ha? Abroad, so not
this
short flights.
okay. Disclaimer.
Gusto ko yan.
um, we've traveled 2 or 3 times. No, I think. So overseas, but this was required. No, we needed it for work and for my child's visa. But the airplanes actually have developed their filters are better. Their air circulation is better. If you adhere to your minimum health and safety protocols, I think it would be safe. Um, having fully vaccinated children would also be
Yeah.
very helpful, no, before you travel. But if you're just sticking to the minimum, which is using a good fitting mask, again, good hand hygiene. If you can try not to eat with the rest of
That was my
the
next question. That was
with
my
the rest
follow-up
of the plane, what we usually do is we reserve our meals before our flight, so we
Mm.
get served the meals first, and then we eat first. So that's usually one thing that you can do. You can, I don't know, reserve a seafood meal or something like that.
Oh,
Uh,
okay.
or you can just wait for the others to finish, and then you remove your mask and eat. But I would not advise you to eat with the rest of the crew.
Wow. Eh, paano lahat naghihintayan? Wala nang kumain, nag-landing na.
Now that's
They all got the same advice from Doc Jack.
just
No, but
remove
that's
your
great.
mask and then.
Yeah. Oh, that's very practical. Great advice. I have this last question. Um, are there any indications or trend that there will be surging or there will be a surge sometime in May?
So the
Ayan.
month is a little bit hard to predict, no? But actually, again, as I mentioned, we were listening to some podcasts abroad, no? Apparently, what they do sometimes is they look for coronavirus in their wastewater, so in their sewage. And they notice that when the amount of coronavirus in the wastewater starts to go up, they have a surge a couple of weeks later. So their prediction there, and this is the United States, their prediction is that they will have a surge around summer. So that's June, July. So maybe not May. Maybe may time pa tayo before the next surge. But yes, sometimes there are red flags or signals saying that, maybe a surge is coming. But it's really hard to predict whether it's May in the future or hopefully that it never happens. But there are some signs.
I love that. Thanks for managing that and handling that, Doc Sibel. And honestly, at the end of the day, the message to me is we really still are in a pandemic. We have to continue taking the health and safety protocols, even to our children. So I like that. Thank you to our attendees for sharing with us those questions, and of course to Doc Sibel and Doc Jericho for also answering them. But of course, before both of you go, I would like for you to ask, or I would like for you to share some keys for all of us to live our best life. That's what Maxicare is all about, right? Maxicare wants for all of us to live our best life. And I'd love to know from our experts, what are those keys to be able to do just that? Doc Sibel?
So I think the keys to living your best life during the time of pandemic is all about prevention. So that's the first bullet that you see on your screen. So you want to be able to remember all the layers of prevention that we talked about. So not just the vaccine layer, but keep your mask on, go to well-ventilated areas, try to practice still physical distancing. And for the second bullet, it's all about finding the right balance. And I think a way to think about that is another P is about prioritization. Ask yourself before you go out, before you go do something, is it really necessary? Is it a priority? Is it part of your priority list of things to do? Because it still is a pandemic. So that's the third P. So don't forget that. So we still have to remember it's still not yet back to normal. We're very close, but we really don't want to have another go around of round 4 or round 5. So I think those are my tips to living a good, well-balanced life.
I love that. Doc Jericho, please add to our keys to living our best life, and especially for our children. Diba?
Right,
Especially for
right.
our children.
Again, so even though we are seeing a decreasing number of COVID cases here in the country, as Dr. Abad said earlier, we should still be aware of what's going on with the rest of the world. No, we usually follow the trend. From experience, we usually follow the trend a few weeks or months after a surge from other countries. So hopefully this does not happen, of course, but we should still be prepared. No? Stick to your minimum health and safety practices. Prevention is key. You would rather prevent the illness than have to deal with the symptoms and complications. No? So wash your hands, wear your mask, try to still do social distancing, and continue to vaccinate. Mental health, of course, should not be taken for granted. We do recognize that some can't just stay inside forever. Just be safe when you do go out. Choose wisely where you go. If you want to go to a restaurant, maybe go where you can eat outdoors. Or if you want to go out for leisure, probably choose a park instead of an enclosed area.
Noted. Thanks so much to both of you for giving us that wonderful list of keys to living the best life. And that's exactly what we want to do. And what we want to do right now is to really honor you and thank both of you for a wonderful discourse here at our Maxicare Wellness Fridays. Again, thank you so much, Dr. Sibel Abad and Dr. Jericho Alvaran. I hope to see you guys in person sometime soon. Take care.
Thank you.
Thank you.
All right. Well, what a treat that was for have that to have that conversation with our experts and also with you. We really appreciate all the inputs, the insights, and even the questions that you guys shared. It's amazing. And I really appreciated, didn't you, how thorough our experts were in today's discussion and even our live Q&A. And of course, it's all because your questions were great. So thank you so much. I know that all of us, not just me, learned a lot. Now, can we have you guys answer a short survey that will give us valuable insights for future events? All right. Here's the QR code that you're seeing on your screen right now. And someone is already sharing on the chat the link to that survey. I appreciate that. Thank you so much in advance for answering that survey. Now let's announce the winners of our raffle exclusively for our pre-registered attendees who are on Zoom right now, who gave us a topic that they would like for us to tackle for future Maxicare Wellness Fridays event. Remember that they will get an EGC from Healthy Options worth 500 pesos. Ang dami nating mabibili doon. Ang sarap. All right. Here are the winners. Congratulations to these people. Congratulations to J.M. Moscoso, Delia Fuentes Pina, Joel Alcasabas, Kenneth Irvin Garcia, Suzanne Almendral, Luis Charmaine Gumban, Felisa Uy, Cherry Caceres, also Ellen Rose Del Rosario, and finally rounding up our 10 winners for our Maxicare Wellness Fridays is Jennifer Rios. Congrats, guys. Great job. And thanks so much for sharing your insights with us. Now, for those of you who also want to get a chance to win these really awesome and cool prizes, please make sure that you register for the Maxicare Wellness Fridays events and join us on Zoom. I appreciate you guys watching us on live stream. Thank you so much. Did you hit that like button? Did you hit that share button? I hope you guys did. But I'd like for you guys to come and join us next time because there are prizes to be won. But we will share more details later on how you can join our other Maxicare Wellness Fridays event. But as we reach the end of the event, we'd like to ask a few moments from you again to answer some of those questions related to our Wellness Fridays. Just select an answer that best represents you, and you will see the poll question being launched right now. On a scale of 1 to 5, 5 being of highest importance, how important is it for you, ladies and gentlemen, to live your best life by focusing more on your wellness? I love that question because for us to really live our best life, we have to focus on that. But on a scale of 1 to 5, where are you at? So let's see our poll results. 1, 2, 3, 4, 5. And of course, I love that 94% of us, kasama na ako dyan, feel that it's really important for all of us to focus on our wellness because that's really our key to living the best life. Remember, just like what Doc Sibel and Doc Jack shared earlier, great job, guys. Here's the second one. If you were able to join us in our previous events last year, and those are also great, have you found Wellness Friday sessions like this one informative and useful regarding how you can take better care of yourself? Madami ba kayong napupulot? Madami ba kayong natututunan? And it's really good, to hear from our experts. And I hope you guys also like this format. But let's take a look at our results here. Yes, overwhelming naman talaga. Thank you so much. And I love that you guys really enjoy our series. And the final one, can you guys help us? Can you rate today's Wellness Fridays event? And of course, we rate it on how it has helped you further improve your health and wellness, especially now that you know more about coronavirus, even from a parent's or an adult's perspective, how we can help our children and the young ones. So magbigay kayo ng grade ba on a scale of 1 to 5. So let's see the results for that one. I'm sure that it's going to be overwhelming sa 5. So we appreciate your time and your, of course, insights by joining this poll series of poll questions. Now, if you guys enjoyed this experience, please do share it on your social media using the hashtag Live Your Best Life and hashtag Maxicare Wellness Fridays, and tag Maxicare on Facebook at Maxicare Healthcare Corp, and also on their IG at Maxicare Healthcare. Please also take a look at Maxicare Health and Wellness on IG and do tag them when sharing about your wonderful takeaways from this event. Don't forget to subscribe to their YouTube channel, also Maxicare Healthcare Corporation. To learn more about Maxicare's products, please visit www.shop.maxicare.com.ph, or you can send a message to them via their FB Messenger. But if you do have questions about this Maxicare Wellness Friday series, please do send an email to maxicare@maxicare.com.ph. See you guys on the next Maxicare Wellness Fridays event in April. Yes, we're going to get to do this monthly, and I'm glad we get to be together for that. Looking forward to it already. The details will be announced soon. So stay tuned and make sure that you register early. Again, for those who are just watching us on our live stream, we invite you to join us on Zoom. So register for the next one. Make sure you guys are following Maxicare on their social media pages so that you won't miss out on the announcement. So don't forget to register so you can also have access to exclusive perks to those who have previously or pre-registered for our Wellness Fridays events. Well, that ends our event for this evening. Thank you so much for being with us here. We hope that you enjoyed it and you were able to take away meaningful information. Thanks, everyone. Have a great day. I'm Patricia Hizon, and remember that with Maxicare, you can live your best life.